So stay home. Only go out when absolutely necessary. Do things like plan ahead when you're buying groceries. Maybe get a couple extra things. But really, you should be staying home. The Guam Police Department is doing checkpoints, and they started those last night. And we got more info on that coming up. But first, he was on yesterday, and basically meeting with the governor last night, Dr. Hoa Nguyen. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Good morning.
So we just wanted to recap. We know that you guys had met with the governor last night and her people. So what went down in that meeting?
Yeah, Chris, yesterday the governor advisory committee met together, but the governor is not supposed to be there. So we just basically talk with each other, and that's like the biggest challenge that we basically talk a lot about is the chronic care management. A lot of the people in Guam, we talk right now about the COVID patient and what we do with it and all that kind of stuff. But this thing not going to go over like tomorrow, the next day, and next month. It's going to probably the rest of this year. And what we forget now is that before this thing come, we have a huge problem our disease in Guam, and that's including diabetes, hypertension, and cholesterol. And that's what we forget. So we talked a lot about last night because, as you know, and everyone know that a lot of people are staying home. A lot of people are not going to work right now. And sooner or later, these things, go on. Quite a few of us will not have a job. So, when you don't have a job, you might not have your health care insurance as you have right now. And what we talked in committee last night is what to do with those people that does not have health insurance like they used to on the visit to the clinic, who pay for the visit, who pay for the medication, how they obtain the medication. Because if we don't take care of this problem right now, we're going to have another wave we call non-COVID patient going to hit the hospital having a heart attack, have a stroke. It's a big challenge. It's a big talk, and that's what we try to come up with an idea to try to guide the governor and her decision of how to cover for these people that eventually will lose their job in the next few months. It's hard because you can see your doctor, but the medication sometimes costs hundreds. And, people don't have $100 for the medication. And so that's what we see in our private clinic right now is that people, when they stay at home, that their blood pressure go up, their diabetes getting worse. So it's finding the funding source to try to help these people in the next few months, maybe way up to January, February next year.
So you guys discussed this amongst your group, and when do you plan on presenting this to the governor, your concerns?
We will present a little rough draft to the governor yesterday to Dr. Mike Cruz. We are going to, this Sunday, we're supposed to meet because it's a holiday this Sunday for a lot of people. But we're going to probably try to finalize this probably on Tuesday or next week. Just to give her a rough draft that she can work with. It's a challenge, you're talking about, the thousands of people that might not have health insurance at all. Mm-hmm. And we've also, talking about the cost for the medication, especially the medication, pharmacy have to somehow take the risks of either fund the money or whatever they need to do. Because they have to get paid for their supply.
Mm-hmm. Was there any discussions in your meeting about these alternate care facilities that are supposed to be standing up at some point in time, or discussions about FEMA's resources that they're deploying here or have deployed?
Yeah, when Dr. Lewis Cruz, he's a major in the U.S. Army. He's responsible for that, and he gave us an update on those things, and they're still moving forward on securing hotel to get ready to be used as hospital in case we need it. The key here, we plan for the worst, right? And if it doesn't happen, then it's good for everybody. We love to be wrong. Everyone here, like I say, every citizen on this island is a soldier, and we all fight. That's why it's the message that Chris said this morning: stay home, stay away from other people, use a mask around public, because all of us are fighting, and if all of us are fighting together, hopefully all this projection is wrong, and we don't need to use those hotels. But yes, they are looking at 2 hotels, and they are trying to come a plan to convert those hotels into a place where people can be used as hospital.
Mm-hmm. And when you say that they're trying to convert these 2 hotels, are we looking at those hotels to be used for just the civilian population, or will we see sailors from the USS Theodore Roosevelt also being able to be treated there? Because when you look at the numbers that were just released earlier today, there's 416 that have tested positive, and I'm just wondering, where would all these sailors go if things turn bad?
Yeah, this is strictly for civilians.
Just
the Navy, they take care of their own, and and they the good part about the Navy is that they own young, and typically young people have much mild case and symptom than the elderly. The one that we are currently in the hospital are the elderly with multiple comorbidity. These are active duty people that's young, so just like anything else, they're going to have some very mild symptoms and they recover fine. So, if you play the odd, most likely they will not need a hospital, including ICU hospital, at all. So they still very, like I said, they're young and active.
Yeah, we just had news, though, this morning, Doc, that one sailor has been admitted to the ICU and another has been hospitalized.
Yeah, that's we know anything can happen, but like I said, we don't know much detail about it to see why they, the person I just read on the news about taking the hospital, but there's other reason they taking the hospital. I'm not quite sure that COVID related or not. Because we don't have the detail of the reason why.
Yeah, I think it is because this was the Joint Chiefs of Staff Air Force General John Hyten who announced when he was breaking down the numbers.
Yeah, but we don't really know that which hospital they go to. I don't think that they go to any civilian hospital, because the Navy hospital is a huge hospital. I think it's making for a war-like scenario. They can convert that to 1,000 beds. So.
Did you say convert it? Because when I was reading up on their website, it's a 42-bed facility.
No, but that's for regular.
Okay.
If, in case of war, that hospital can convert into a lot of beds.
Yeah, I've been there. It's huge.
Yeah.
Yeah. So it's just right now. It's just there's no sense of doing that in case of peace, but in case of war, that hospital is gonna hum. Yeah.
Right.
Okay. What about the rapid test kits? Was there any discussion about that?
We come up with the guidelines pretty much on who's going to be receiving the test kit and who's going to implement it. So in general, the majority of test kits will go to both the hospital to test the frontliner, okay, and then 50% of that will go toward certain clinics in order to do the patient care on the outside. So, those kits really, remember, myself, Dr. Blair talked yesterday, the screening kit, we screen for COVID-19. Even when you're positive for it, most likely you have, but you have to be confirmed by doing PCR testing.
And just so people are clear, the PCR testing is the test kits that we currently have, and then the serology is the rapid test kits. And the serology is through like a blood sample. And
it's a blood sample. It's a finger prick, and you can find out about 10-15 minutes. The PCR take longer. The good news about it is that I know that GRMC also tried to stand up their machine, and also there's a high possibility that DOS will might be able to do that locally, just because they are in support with the Navy hospital. The Navy hospital.
And the rapid test kits, you have to send them. You said public health would be able to run those tests.
No. The rapid test kit will be run by either the hospital, and I will leave the GRMC and GMH alone for them to implement their own program. But for civilian wise, for our local physician, they can go to a certain clinic, and when you see the patient, you can use the rapid strep test. The rapid kit, just to try to see if the patient are positive or negative. Like say, if it's positive, you can run the PCR to confirm it. If it's negative, if the patient really looks sick, in front of you, and the test is negative, you're going to scratch your head and say, okay, we're going to need to get the PCR to confirm that this is a false negative.
But if you're fine and you get the rapid test kit, then the likelihood that you are negative.
Right.
Is negative.
I mean, you have to have some symptoms, Sabrina. I mean, if you walk into my office and you actually have no symptom at all, and you say, I've been exposed to someone that have COVID positive yesterday, I will not run the test.
Okay.
Because, you're not going to have enough ground load or anything to turn positive, and I'm not going to waste the test kit on you. I just tell you, go home, isolate yourself at home for 14 days, and if you have any symptom, then come back, let us know, and at that time we might retest you.
Is these rapid test kits, you might have said it, but I just want to make sure I'm clear. Is this just for the priority groups, or is this for everyone that is experiencing symptoms?
No. We break it down priority group. The highest one is the hospital and the frontliner.
Okay.
And the frontliner is symptomatic. And we have the next priority group is basically other people in the community that basically have mild symptoms and also have no other comorbidities. If you are like yourself, right, you are healthy and you don't have anything, you come in with fever and some coughing and diffuse body ache. In the past, we cannot test you because we are so short, but now you are a perfect candidate for me to do the rapid test just to see if you're positive or negative.
How many of these rapid test kits do you guys have?
Right now, 0 is on the way, but we have to make sure that they are FDA approved. So once they get here, all the test kits will be handled by custom to make sure that they are FDA approved. If they're not FDA approved, there's a lot of test kit out there that is fake and is defect. So they have to be kind of confiscated by custom and take over the public health in order to kind of verify that, number one, the FDA, number two, and they don't have no defect in those test kits.
How many are we anticipating, though, to receive?
We don't know. That's the thing. That a lot of local company we heard that they order thousands of those test kits to come in to use for their employee, and
what company was this, Doc?
We don't know, Chris. We don't know, but that's what we expect.
I heard it was Cortec.
Yeah, so we're going to kind of confiscate all those test kits because, like I said, you can test for anything, but if you are involved with a virus like this that can be life-threatening for the community, you do not use that to clear people back to work, because you put a lot of people in danger for doing that without proper supervision from the physician and without involving public health in this loop.
Doc, construction is still ongoing. We get a lot of comments about construction, in terms of the number of bodies that are out there on any given construction site. What are your thoughts on that?
Construction, some of them are very essential, especially the Navy and Air Force. They still have to get their building up. They have everything up because, the plan of expanding the military here in Guam is still very important. So that process most likely will not stop. But, those companies have their own physician that kind of take care and monitor the worker, make sure they don't have any symptoms. And they usually, the physician usually kind of lock them down in the barrack and not have them go nowhere. So kind of minimize the interface between them and the people around them, just to try to keep them isolated so they won't get sick. But again, if anyone that gets sick, I'm pretty sure that the physician take care of them, will lock them down in an isolation, in a barrack somewhere.
Well, it's a lot of pressure to put on a private company.
Yeah, it's a thing. It's a private company that that is not working on base. They really have to do the same thing. There's a huge difference between the private company that do construction outside the gate and inside the gate. Inside the gate, they have a lot of restriction and a lot of requirement they have to put on the employee in order to be safe to work on base. Now, off base is a different story. They don't follow that.
Okay. Anything else that you guys discussed last night that you can share with us?
That's the main thing. Just a thing about the chronic care management, Sabrina. Krishna, that is something that I tell you we are all nervous about, because this is, I say, we were hoping that it's going to last just a month or two, but it's not going to happen. It's going to last the next year. So the people that have diabetes, hypertension, and cholesterol, and all other risk factors, they really need to get together with their physician and try to iron a plan of care, because like I say, we do not want to have a non-COVID wave of patient hit the hospital, and the hospital really in trouble. So try to stay healthy, try to exercise as much as you can, and try to watch what you eat, so you don't get sick. Again, we come to a holiday again this Sunday. The key here, do not barbecue and mingle with a lot of people. You can make sure that you spend time with your elderly, but do not hug them, don't come close to them, because this is where we're going to take a little more wave of people getting sick because of this occasion. So stay home, wear the mask, don't congregate, don't party with your next door neighbor, anything like that,
Right.
and kind of respect your elderly and say hi to them, but do not come there to hug them, because you're going to get them in trouble.
All
right, Doc.
Okay.
And so the governor has kind of, in her press conferences, talked about additional guidance in asking people to only commingle with individuals that are in the same household. How important is it for us to follow this advice?
100%. I'm 110%, Chris. You really have to follow this advice. Like I say, this virus will take advantage of every opportunity like this special occasion to move forward and spread. So we all have to do our part in this one to prevent another wave of hitting us. Okay, it's very important. Yeah, she's absolutely correct. You have to do this. Okay, Doc.
So how are you changing up your Easter Sunday? I just want to know, because, we're all doing it, but you as a guy on the Physicians Advisory Council, we know you're right on the front lines of COVID. How are you doing your Easter, Doc?
I'm going to isolate myself on my boat and go fishing, Chris, Sabrina.
There you go.
I need it. I'm going to get seasick, because I haven't been on a boat now for 3 to 4 months.
Wow. Okay, if you want to isolate anything you catch over here, you let me know. We have the technology.
Okay, thank you, guys.
Wash your hands, Doc.
I will.
Okay.
Thank you.
Be safe.
There you go.
Have a good day. Bye-bye.
Bye.
There you go, 7:30. That's Dr. Hoa Nguyen. He's on the Governor's Physicians Advisory Council. So that's the conversation that they're going to take to the governor. How are we going to handle these chronic care patients who are struggling with, like you said, the typical chronic conditions? And that's, I want to just, on a side note, that's one of the reasons why guys like Dr. Cabrera are so worried about the COVID-19 situation on Guam, is because they say, when you look at New York and Italy, world-class hospitals, all the doctors know that, they got some great facilities. So for those country, and New York to be hit so hard and to have their facilities, bend and break. And given that our population is way more vulnerable, so we have, way more people with the comorbidities per capita, and that's why the doctors are concerned, and that's why you got the power.
Yep.
Kill the curve.
And you need to stay home and exercise when you can, and wear a mask, wash your hands, and really just stay home.
Yeah, and of course, we all know it's tough as we're heading into, this has been how many weeks? We're going all the way to May 5th. So this is where you start